We are now in our third year grappling with this pandemic, and a recent poll suggests that fatigue has set in. 70% of Americans polled agreed with the following statement: "It is time we accept COVID is here to stay, and we just need to get on with our lives." Of course, that is a complicated statement if you are particularly vulnerable or already touched by serious illness. For more on all of this, I want to go now to Dr. Ashish Jha, who is joining us. He's the Dean of Brown University's School of Public Health, and he's going to talk about where we are in this fight. Dr. Jha, I want to get to your metaphor of a rainstorm and COVID being that rainstorm, and the rain is starting to taper. But before we get into that metaphor, the news about the Pfizer vaccine potentially being available soon to children under the age of 4, how big of a game changer might that be for our fight?
Good morning, and thanks for having me here. I have a lot of friends who are parents of young kids under 5, and for them, it's a huge game changer, right? It makes an enormous difference for them in terms of knowing that their kids are protected and reducing their anxiety. I do expect that authorization to happen in the next month or so. I'm really looking forward to it. I think it'll help a lot.
So the rain metaphor, you put out a series of tweets yesterday saying that cases, i.e. rainfall, are going to be falling, and it may be time as a result to actually remove some of the mandates and restrictions around masking and other aspects, and not having large indoor gatherings. Walk us through the case, because I think a lot of Americans are hungry to hear the idea that, hey, we could be getting back to normal soon.
Yeah. So look, I've found that a lot of the kind of politicization of these public health measures has been really puzzling to me. I mean, when there is a major storm, we don't fight about whether you should take an umbrella, wear a raincoat. But when it stops raining, turns to a little drizzle, or stops raining altogether, it's fine to put away your raincoat. And that's basically the analogy I'm using. The Omicron surge was a massive thunderstorm, massive bucketing rain. It made a lot of sense to have masks. It made a lot of sense to be doing testing all the time. Obviously, I believe everybody should be vaccinated. But what we're seeing is cases come down. They're down about 50% from their peak. My expectation is that in the next couple of weeks, cases are going to really go down much, much further. And at that point, it's reasonable with relatively few infections in the community to pull back and say indoor masking requirements are not going to be there. The indoor gathering restrictions are not going to be there. Obviously, we'll all still have the protection of our vaccines. And there are two reasons to do it. One is I think people need a reprieve. And the second is if there is a large surge in the future, we want to be able to go back to people and say, hey, another storm coming, put on that raincoat, put on those, grab your rain gear, and let's get through the next storm. That's, I think, how we manage this virus.
Yep, grab your rubber boots. I like the analogy, Dr. Jha. Most Americans say they consider this pandemic over when it's just a mild illness. I want to know, what's your criteria on when this pandemic is over for you?
Yeah, well, one is I want to get to a point where hospitals are not getting filled up to a point where we can't take care of people with heart attacks and strokes and appendicitis. That we are not there yet. I also want to get to a point where 2,000 Americans are not dying every day. So we are not anywhere near the end of the pandemic, just based on those metrics alone. I agree. Once it is at a point where for most people, it is a mild illness, that will make an enormous difference. There isn't a single point, Gayle, where the pandemic is over. The pandemic will fade into the background and matter less and less the more we get people immunized and the more we really begin to manage this virus effectively.
Dr. Jha, final question. As people can choose their risk tolerance more and more, what do you know about so-called one-way masking? Meaning most people may choose not to wear a mask, but if you're particularly compromised, you'd wear one to protect yourself.
Yeah, this is actually a really important point. If you wear a high-quality mask, a KN95 or an N95, which are now widely available, you can protect yourself under pretty much all circumstances. When I think about when I've been in the hospital taking care of sick patients with COVID, I'm wearing an N95, and the patients are not necessarily wearing masks. And yet I know that I am protected by that. And of course, I'm protected by my vaccine. So for immunocompromised people, for people who are worried about getting sick, wearing a high-quality mask provides an enormous amount of protection against getting infected.
Hey, that's great to know. Here comes the sun as far as I'm concerned. Dr. Ashish Jha, thank you very much.
Thank you.
Let's hope so.